What is the appropriate minimal risk for vulnerable populations in research? Imagine participating in a study where you might feel unsure or uneasy. Now think about how that feeling could be worse if you belong to a group that needs extra protection. That's why understanding what minimal risk means for vulnerable populations is so important. Minimal risk in research means the chance of harm or discomfort is no greater than what you normally face in everyday life or during routine health checks. For most people, that might be a quick blood test or a physical exam. But for vulnerable groups, this standard needs to be carefully adjusted. Vulnerable populations include children, prisoners, pregnant women and their fetuses, people with mental or decision-making impairments, and those who are socially or economically disadvantaged. These groups might not be able to give full consent or might be more easily influenced or coerced. So, research involving them must be extra cautious. The main idea is that the risk should be no higher than what these individuals usually experience in their daily routines. For example, a child's daily life might include playing, going to school, or routine doctor visits. If a study involves a procedure that mimics those normal experiences, it might be considered minimal risk. In research with prisoners, the risk should also reflect what they face inside the prison environment. Since prisoners are a vulnerable group, the risks need to be carefully balanced against potential benefits. The goal is to avoid exposing them to unnecessary harm just because they are incarcerated. The ethical principles guiding this are respect for persons, beneficence, and justice. Respect for persons means honoring their autonomy and protecting those with less decision-making power. Beneficence involves maximizing benefits and reducing harms. Justice ensures that the burdens and benefits of research are shared fairly. To meet these principles, extra safeguards are put in place. These include thorough informed consent processes, independent review by ethics committees, and limiting risks to what is truly minimal unless there is a direct benefit to the participant. For children, federal rules specify that research should be no more than minimal risk unless it offers direct benefits. For prisoners, the risks are assessed considering the prison environment and their specific vulnerabilities. In practice, the idea of minimal risk is not a fixed number. It depends on the specific group involved and their daily experiences. What's minimal risk for a healthy adult might be different from what's minimal for someone in prison or with a mental impairment. Overall, the goal is to keep risks within the bounds of what these individuals normally face, while making sure their rights and well-being are protected. This careful approach helps ensure research is ethical and fair for everyone involved.